Hi everyone, I'm Dr. Justin Lin here at Rehab and Revive Physical Therapy, where we're looking to rehab your mind and revive your body. So today I want to talk about a great exercise that I use here all the time. We call it hip holds, and we're going to call it hip holds number 1. It's in the sequence. It's geared to help your lower back, improve strength in your hips and glutes, and then decrease that use of quads. We don't want those quads kicking in. So stay tuned. So why is strengthening the glutes, hamstrings so important for those of you with lower back pain? Well, you have to kind of see a model for yourself. So we're going to talk about that in a second. But overall, we have an overactive quad society. I said that right. Overactive quad society. And what we need is that extra padding. We need those hamstring muscles, because what they're really geared for is they're made for endurance. These hamstring muscles are endurance muscles. They keep things stable in the hip. They're almost used for every bit of life. Anytime you're upright. So if you're laying down, you don't really use it, but when you're walking, sitting, standing, you need it all the time. So Griffin, I want you to cue the side pelvis. All right, here it is. So over here, we've got the quadriceps muscle. We got a little side view here. And then we've got the back view of the hamstring muscles. What happens is when there's overactive quads right over here, what happens is your pelvis is gonna tilt and it's gonna move this direction because there's nothing keeping it back. There's no backstop to this. Now what happens here is over time, when this keeps pulling, you get thrown into anterior pelvic tilt. And then over a long period of time, those hips start sliding forward. So we don't want that. Those quads will always pull that forward. So in order to get better, in order to get your pelvis back to neutral, you want to pull it all the way back, just like one of those rope machines or something, steering wheel. Pull that back and then right over here. So that's the goal. We want that happy pelvis, that even Steven pelvis, and then then we're gonna move well throughout life. So we don't need this anymore, Griffin. Knock that out. All right, so we're gonna stay tuned. I'm gonna show you the great exercise that you're gonna need. Hip holds number 1. All right, so what you're gonna need is you're gonna lie on your back and you need a firm belt. A regular belt works fine. Sometimes people use towels, but I love a yoga strap. That's perfect. So not one of those stretchy bands or anything. What you want to do is you want to set it up behind your thigh, and then what you want to do after that is to engage your buttocks. You want to tighten it first, you want to load it down, and you're going to start shaking. You're going to hold this till the shakiness stops. If you have any questions of why the shakiness, watch our video about shakiness. But this is going to be really important for us to get this initiated. And then we start on our back. This is hip holds 1. But if you're interested in hip holds 2, that's when you can do the same exercise in sitting. So let's proceed. What we'll do is I want to load this and pull this pretty tight. I want to tighten my butt first. Then I want to relax. I don't want my foot up per se. I don't want my foot up, but I want to relax it here. And then I want to drive it down. I want to drive. This is the action. So my left side, notoriously bad just for just about everything from head to toe. So we want to get these muscles activated. And as you can see, I'm starting to shake right now. Now the shaking is really important. Like I said, trying to integrate that brain to body, and I'm going to shake for some time. Sometimes it's 15 seconds, sometimes it's 20, sometimes it's 90 seconds, sometimes it's 30 minutes. Whatever you got to do to wake up this muscle is the key. And now it's on. So this is soft, this is hard. I tell people, soft like tofu, hard like well done steak. So soft like tofu, hard. And sometimes I just keep that there. I want to make sure this is, and I can yank on it, make sure it's solid. And once you've got this engaged, and once you've disengaged this exercise is done. And that's pretty much it. And we're back. Hopefully you gave hip holds 1 a shot and you really start noticing things moving a little bit easier, a little bit lighter. Your stride's getting a little bit longer and you're just moving forward in life a little bit better. So this is really key. Those glutes, those hammies are your motor to push your life, your body, everything forward. We'll just keep moving forward. That's what we need to do right now in our lives. So hopefully you check with your healthcare professional and this is a safe exercise for you. Everyone loves it here. It's one of our first exercises for many to help their lower back pain, knee pain, ankle pain, brain pain. It just helps every kind of pain. So give it a shot and leave your feedback. We'd love your comments below. Make sure this is doing the exact same thing I promised I'd help you with. And leave likes, share this video if anyone needs it, and then please subscribe. We're always throwing out new material all the time and trying to make these videos a little bit funnier, getting a little bit more comfortable on the camera. So I'm Dr. Lin. Remember, we heal smarter, not harder.